International Overdose Awareness Day is observed worldwide on August 31st and aims to end overdoses and overdose deaths by destigmatizing drug use, something that advocates say is at the heart of harm reduction.
Human beings have always used substances either to relax, to enlighten themselves, to party, as toasts, around dinner. It's the stigmatization that prevents people from talking about their substance use, seeking help where they need it.
Colin Johnson from Toronto Harm Reduction Alliance says drug use is far more common than we realize, and conversations and funding need to focus on promoting safe consumption.
Most of the money goes to enforcement. It goes to the police. It goes to arresting people. If we start putting more money into harm reduction, then you start getting people educated.
Johnson says education about safely consuming drugs and facilities where people can do so makes overdose both preventable and manageable. Councillor Chris Moyes, chair of the Toronto Board of Health, agrees, saying drug use is a health issue, not a criminal one.
I've reached out to the federal government to make sure that we need to decriminalize drug use. This is now a pilot project in Vancouver, and so we've asked for a Toronto-centered approach as well. We've actually submitted the second application to the federal government so that we could actually start the process of that happening.
Moyes hopes to have a response by early next year. Johnson says part of the reason why opioid toxicity deaths have doubled since 2019 is due to contaminated drugs, making it difficult to judge their effects. He says decriminalization will help create what's called a safe supply.
The government would purchase the substances just like they do liquor. You're going to a store, you know what you're getting, you know how your body deals with that.
To further these conversations on Overdose Awareness Day, cultural worker Steph Juniper is organizing a Pay What You Can benefit concert called Noise Against Overdose Death, and all proceeds go to Toronto Indigenous Harm Reduction.
We feel that while mental health is often talked about, addiction is really pushed aside. It's something that really needs to be addressed in terms of how we talk about drug use. Overdose happens, so it's really important for us to talk about it as just a thing that can happen and something that can also be prevented.
Any one of us could fall through the cracks. Just be supportive of those who need the support in a non-judgmental way.
36,000 people overdosed between 2016 and 2023. Those are numbers. But for each one of those numbers, it's a friend, a family member, it's somebody, it's a human being.
Dilshad Burman, City News.